Hello, this is Dr. David Bilstrom from the International Autoimmune Institute at Brigham Memorial Hospital. This installment will be about the thyroid. Now, they call thyroid the great mimicker because it can look like about anything when the thyroid's off. It can look like, geez, I'm sore, geez, I'm tired, geez, my brain's foggy, I had these bad flows, I had these bad cramps, my skin's dry, my ears itch. You get the picture. I may have whetted your appetite about what thyroid can do in our previous installment talking about vitamin D, and one of the reasons that vitamin D has such a profound impact on the body is that you need your vitamin D level to get to at least 70 to optimally get thyroid hormone into the cells so it can do its work. So the list I kind of started giving last time when thyroid was low was depression, weight gain, constipation, headaches, migraine headaches, broken nails, dry skin, menstrual irregularities, fluid retention, poor circulation, anxiety, panic attack, memory issues, concentration issues, lots of things. Now, they used to think perhaps 3 to 5% of the population was low in their thyroid. Some researchers believe that up to 40% of the population now is hypothyroid. It seems like this increase has paralleled perfectly the advent of using antibiotics and the continued use of antibiotics. Now, why would that be? Well, researchers hypothesize that it's because children with hypothyroidism get a lot of infections, and before the advent of antibiotic use, these children died. Now, because we have antibiotics, fortunately, these children don't die, but they live long enough to pass the genes on to the next generations, and then their children have the genetic predisposition for hypothyroidism and all these infections. Now, it used to be that as long as somebody with hypothyroidism took enough thyroid medicine, they did fine. Now, we're going to use, for example, the optimal doses used in medicines like Synthroid, the T4 medicines, T4 being a relatively inactive thyroid hormone, but you would like to turn into the active usable kind rather than the inactive kind that gets in the way. Originally, when people would use T4 thyroid medicine like Synthroid, the doses that were used to optimize symptom control were between 200 and 300 micrograms. With TSH as a test being invented in the 70s, people started basing dosing on TSH levels rather than symptom control. And right away, doses went from 200 to 300 micrograms each day to between 100 and 150 micrograms per day. And you see right there that with the advent of the use of TSH, the dosing went way down, and the ability to control symptoms went way down as well. In England, where the medical system is as it is, doctors are told that they must treat hypothyroidism based on TSH levels rather than on symptom control. Thus, when a patient comes to see a doctor, they're not asked how they're feeling on their current dose of thyroid medicine. Treatment is actually based purely on TSH levels. Now, the nurses' unions in England have been fighting for decades to have thyroid medication doses based on symptom control rather than TSH levels. Now, in the past, as long as you had a T4 level or a Synthroid dose, let's say, that was optimal, you would get optimal symptom control. But something has been changed in the last 20 to 30 years, where even if people have optimal T4 levels, and many of you may have experienced having your T4 tested and told that it looks ideal, but you still don't feel well. The problem is T4, the relatively inactive form of thyroid hormone that gets released by your thyroid or that you may take orally, gets into the system, goes to the liver, the kidneys, the gut, and other tissues to try to turn into the active, usable form of thyroid hormone called free T3. Or it could be changed into the inactive form of T3 called reverse T3. Now, something profound has happened in the last couple decades. What they're finding is people are having a very difficult time converting their T4 into the free T3, and instead they're going the wrong way to the reverse T3 that blocks the free T3 from working. Now, what are the things that makes a person a bad converter? Stress, the stress hormone cortisol's off, vitamin deficiencies, toxicities, and eating too many carbs and not enough protein. Now, life in the 21st century, everybody is vitamin depleted, everybody's stressed, everybody's toxic. Everybody eats way too many carbs, not enough protein. The standard American diet, very high in carbs. So you see that life in the 21st century is having a profound impact on the ability of people to be able to benefit from T4 medications, but also having a profound impact on the ability of the body to turn our own T4 that our thyroid may make into the usable kind. Oftentimes, people only have their thyroid checked by running a TSH level. Now, we've talked before in previous installments about how different the normal ranges or the reference ranges are compared to where a person should be ideally, where the healthy people are. Now, ideally, TSH should be less than 2 or potentially less than 1 to feel your very best. If TSH is higher than that, then you definitely know you have an issue. But because TSH is basically dependent on free T4 levels, which are the inactive hormone levels, it may not give you the kind of information you want. Now, free T4 levels ideally should be more than 1 in adults, but in children and adolescents may want to be more than 1.4. If they look good, there still could be a problem. If they're low, you automatically know there's a problem. If they are good, the question is, can they turn into the usable thyroid hormone, free T3, or instead are they going into the reverse T3? For free T3 levels, the optimal levels for adults tends to be 3.5 or more. Now, some folks do just fine 3.0, 3.1, 3.2, but most of the time 3.5 or more is ideal. Now, for children and adolescents, ideally free T3 levels should be more like 4.0 or more, maybe even 4.2 or more. Now, in reverse T3 levels, the ones that get in the way, the range a lot of times in labs is somewhere between 8 and 25. Ideally, you want to be in the low end, around 8 to 10. Otherwise, too much reverse T3 is going to be getting in the way of the T3 receptor, so you can't use your free T3 levels even if you have enough to do the work. Thus, you may see why not only is thyroid production important, free T4 coming from the thyroid or coming from medication, but the conversion issue has a profound impact on the ability of people to optimally benefit from T4 medicine, even if the dose is correct. In order to make thyroid hormone, we need certain nutrients. Now, iodine has a profound impact on thyroid production. Iodine is so important for thyroid hormone production that the number of iodine atoms on the molecule of thyroid is actually in the name. So T4 actually has 4 iodine atoms on the molecule, where T3 has 3 iodine atoms on the molecule. Now, there used to be a lot more iodine in our food than there is currently. A lot of times the grains had plenty of iodine. Unfortunately, because of the highly processed grains that we tend to consume, the iodine has been replaced by bromine. So rather than getting iodine from our food, we actually get bromine. Now, unfortunately also, bromine will actually bind to the iodine receptors in the body, so even if you do have the iodine, you can't attach to the receptors and do the work. Oftentimes we see people that have low iodine levels, and because of that, they're unable to make free T4 and free T3. Also, the low iodine can be a big driver of why people develop the autoimmune disease Hashimoto's thyroiditis. So for some people, reversing hypothyroidism might be as simple as adding iodine either through supplementation, an increase in iodine-containing food consumption, or maybe sometimes even just changing back to salt with iodine. One way or the other, as important as thyroid is, you really want it optimized if you want a healthy gut, a healthy immune system, and good immune system regulation. Remember, the body's always ready to heal. You just have to give it a chance.